So some of our patients have difficulty feeding themselves because they may have some hand weakness and they're having a hard time using utensils to cut food. So an occupational therapist will assess their hand function and make an appropriate recommendation to make that easier. So that could include anything from a large handled utensil. It could include using something other than a knife to cut your food, like a pizza cutter. So this type of adaptive equipment or adapted techniques are, these recommendations are made to help a patient use utensils to cut food to feed themselves. Now, the other thing is some patients have shoulder weakness, so they have a hard time getting their shoulder to move far enough where their elbow will bend and they could bring their hand to their mouth. So some recommendations are as simple as, instead of sitting straight on the table with your elbows off the table, you sit sideways and you prop your arm up on the table. So that's a compensatory strategy for shoulder weakness. And then you're better able to feed yourself because your elbow is bending in a gravity eliminated plane instead of against gravity. So lots of times positioning and adaptive equipment and an adapted technique, they sort of go hand in hand and work together.